I'm Assessment-BHolstein. I'm going to be performing a full head-to-toe assessment today. First, I would start by providing privacy for the patient and performing hand hygiene. Hi, I'm Bridget.
Hi.
I'm going to be your nurse today.
Okay.
I'm here to perform just a routine head-to-toe assessment. It's
Okay.
going to take about 30 minutes. Is that okay?
Sure.
Perfect. First, can I get your name and date of birth?
Sure. It's Ed Holstein, 10/25/59.
Perfect. Wonderful. And do you have any allergies that you're aware of?
No.
No? All right. Are you having any pain right now?
No.
Perfect. So patient is showing no signs of acute distress. Can you tell me where you are?
In the family clinic,
Perfect. Can you tell me why you're here?
just for a physical.
Can you tell me what day it is?
It's Saturday.
Can you tell me who the president is?
Donald Trump.
Patient is alert and oriented times 4. The facial expression is appropriate to the situation. Mood and affect are appropriate to the situation, and speech is clear. I'm going to start with the skin and go full head to toe. Okay. Skin is appropriate color to ethnicity. No lesions, wounds, or incisions noted anywhere. Nails are pink in color. No clubbing is noted. And no deformities to the shape or contour is noted. And skin is warm in and capillary refill is less than 2 seconds, and skin is warm in temperature. Okay, for the head, facial features there are all symmetrical. Upon palpation of the hair, no lesions or infestations noted. Cranial nerve 5, the trigeminal nerve. We're first to assess the motor function. Can you clench your jaw real quick? Okay, and can you close your eyes for me and tell me when you feel something?
Now.
Okay. Okay, so motor and sensory function of trigeminal nerve, cranial nerve 5, is intact. Can you smile for me? Frown? Okay. The facial nerve, cranial nerve 7, is intact. Okay. Cranial nerve 11, the spinal accessory. Can you show your shoulders real quick? Okay. And can you lift your head up and rotate bilaterally? Okay. Cranial nerve 11, spinal accessory, is intact. Okay. The eyes, no redness or drainage noted. The conjunctiva is pink and moist. The sclera is white and moist. Okay, I'm gonna test for Perla. Okay, then can you just look at my? Okay, the pupils are 2 millimeters in size, and they are equal, round, and reactive to light with accommodation. That's testing for Perla. Okay, now I'm gonna test for cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens. And this is going to be assessing for the 6 cardinal fields of gaze. Okay, can you just watch my pen? Okay, so cranial nerves 3, 4, and 6. Oculomotor, trochlear, and abducens are intact. Okay. For the ears, no redness or discharge in the external auditory meatus. And okay, now I'm gonna test the patient's hearing by performing the whisper test. I'm going to stand a little bit behind you, and I'm going to whisper a word, and you're going to please tell me what you hear.
Testing. Testing.
All right, cranial nerve 8, the vestibulocochlear cranial nerve is intact. Okay. So for the nose, no asymmetry, deformity, or lesions or inflammation noted. No drainage is present. For the mouth, the lips are pink and moist, the tongue is pink and moist, and the gums are pink and moist. I see. Okay, so for cranial nerves 9 and 10, the glossopharyngeal and the vagus nerve. Normally we would have a tongue depressor, but we're gonna pretend that this is a tongue depressor today. Okay, can you you open your mouth real quick? Okay, put this in, and I see that the patient's uvula goes up and down. And can you say ah for me? Okay, and you fart a test for gag reflex, and that would also test the patient's swallowing reflex. And so in this case, cranial nerves 9 and 10, glossopharyngeal, and the vagus nerve are intact. Okay, can you wiggle your mouth for me? Okay, your tongue for me? Okay, and can you say light, tight, dynamite?
Light, tight, dynamite.
Perfect, thank you. Cranial nerve 12, hypoglossal, is intact. Okay, so now we're going to move on to the respiratory. Okay. And normally, again, normally we'd be listening and doing this assessment with bare skin, but we're not going to worry about that today. First, with the respiratory, I noticed the patient has no accessory muscle use, so that is important. And in the listen for to the lungs, we're going to use the diaphragm of the stethoscope. And we're going to start in the second intercostal space. This is the right upper lobe. Left upper lobe. Right middle lobe. And this side, it's still the left upper lobe because the right side has three lobes, whereas the left side only has 2. Okay. Just listen. Come down a little farther. Now we're going to go to midclavicular. The midclavicular line, listen to the right lower lobe. Mid-axillary, right lower lobe, and left lower lobe. Okay, no adventitious breast sounds seen on the anterior part of the chest. Okay. For posterior, and these are both done with side-to-side patterns. Okay. This is going to be side here, the left upper lobe. Right upper lobe. And this is starting about, this is starting at what we call the T3 area of the spine. So we're just gonna inch our way down to T10, to the right and left lower lobes. All right, this is left lower lobe. Right lower lobe. Okay, so no adventitious breath sounds heard in the posterior chest. Okay. So for cardiac, I'm going to start by palpating the carotid pulses. I'm going to listen to these for 30 seconds. Okay, the rate was 86 on this side for the carotid pulses. The rhythm was regular. The strength was +2. Now I'm going to go to the other side. Listen to this for 30 seconds as well. Okay, 86 on this side for the rate. The strength was +2, the rhythm was regular, and so that means these pulses were equal bilaterally. And for the carotid pulses, it's really important that you assess them one at a time. Never assess them both together. That would be very harmful. Okay. Okay, can you? Okay. Okay, I just had a patient lean back. I'm noticing no jugular vein distension in the neck, and no edema all throughout the body. Okay, now I am going to listen to the heart sounds, and just like respiratory, you would generally do this over bare skin. Not going to worry about that today. And I'm going to start with the diaphragm. Okay. This is the aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Herb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. Mitral valve, fifth intercostal space, mid-clavicular line. Okay, no murmurs heard with the diaphragm of the stethoscope. Now I'm going to listen with the bell. aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. Mitral valve, fifth intercostal space, left sternal or midclavicular line. Okay, no murmurs heard in any of the heart sounds. Okay, now I'm gonna palpate the radial pulses, and I'm gonna do this for 30 seconds. Okay, 80. The rate was 86 for this radial pulse. The rhythm was regular. The strength was +2. Now I'm going to do the other side. Okay, 86 for the radial pulse on the left side. For the rate, strength was again +2. Rhythm was regular, which means they are equal on bilaterally. Okay. So now I'm going to do the dorsalis pedis pulse. And let's palpate this for 30 seconds. Okay, the rate was 86 on for the left dorsalis pedis. Rhythm was regular. The strength was +2. Now I'm going to do the other side. Okay, rate was 86 for the right dorsalis pedis pulse. Strength was +2. The rhythm was regular, and which means they are equal bilaterally for the dorsalis pedis pulses. Okay, now I'm going to do the posterior tibial pulses, and listen to and palpate those for 30 seconds as well. Okay, the rate was 86 for this posterior, the right posterior tibial. The strength was +2, and the rhythm was regular. Now I'm going to do the other side. Okay, the rate for the left posterior tibial was again 86. Strength was +2. Rate, or the rhythm was regular, which means they were equal bilaterally for both posterior tibial pulses. Okay, so now I can have you lay down the abdominal assessment. Okay. First thing I noticed is the skin color is appropriate to ethnicity. The abdomen is symmetrical to the rest of the body, and the abdomen contour is flat. Now I'm going to, there's no caving in or protruding, distension, things like that. And again, we would auscultate with over skin. Not going to worry about that today. Now I'm going to listen to the vowel sounds in all 4 quadrants. We're going to begin in the right lower lobe. Right upper lobe. Left upper lobe. Left lower lobe. Okay, so vowel sounds are present and reactive in all 4 quadrants. Now I'm going to palpate all 4 quadrants. Okay. Any pain there?
Nope.
No? Okay. Any pain there?
Nope.
No. Any pain there?
Nope.
Any pain there?
Nope.
Okay. So, no tenderness or distension is noted and all throughout the abdomen. Okay, you can sit up for me again and come over here. Okay, you can sit down. Okay, first I'm going to check the upper extremities. First thing I notice is for the upper extremities, there are no deformities in the contour of the upper extremities, and they are both symmetrical bilaterally. Okay. Moving down to the lower extremities, I noticed that the legs there are no deformities in the contour of the lower extremities, and they are both symmetrical bilaterally. And so are the feet. Okay. So range of motion. Can you move your arms out? Okay. Can you like this, okay? Can you flex your wrists? All right. Put your arm behind your back. Okay, so patient has full range of motion in the elbows and the wrists and all throughout the arms in the upper extremities. Okay, for the lower extremities, if you can stand up for me. Okay, turn to the right. Okay, and just follow my lead here, okay? Okay, just out. You flex your feet. Okay, now bring it back. You bring your leg back. Okay, okay, bring it up like this. Okay. Yeah. Okay, now we're gonna do it with the other leg. Can you bring it up? Flex your foot. Okay. Come back. Can you come back? Okay, now bring it up like this. And okay. So patient has full range of motion bilaterally in the lower extremities and the knees and the ankles, feet, all throughout the legs. Okay, so now you can sit back down. Okay. Gonna test. Sorry. The testing for sensory. First, gotta test for sensory function of the lower extremities. Okay. So we're gonna do. This is dull. Okay. This is sharp. And if you can just tell me what you feel. Close your eyes and tell me what you feel. While I do this.
Dull,
Okay.
dull, sharp, sharp, sharp.
Okay. Patient has full sensory function in the lower extremities. Okay. So now testing for muscle strength. Can you just squeeze my hand as hard as you can? Okay. So patient has +5 muscle strength in the upper extremities. Full range of motion against gravity with full resistance. Okay. And now and also that is bilateral for both sides of upper extremities. Okay. Okay. Don't let me push on your foot. Okay. Don't let me push on your foot. Okay. So patient has +5 muscle strength bilaterally in the lower extremities, full range of motion against gravity with full resistance. Okay. Okay, so now, can you just stand up for me? Okay, can you walk to me heel to toe? Okay, stand up, okay? And if you can just close your eyes and keep your balance. Okay, that is a negative Romberg test. So, so patient has full and steady gait all throughout the body. Okay, so after doing this assessment, are you having any pain right now? No? All right, perfect. So, well, thank you so much for your time. And in real life, we would take care of the bed and the call light, and take care of the bed. And here is your call light. You call me if you need anything, okay?
Thank you.
All right. Thank you for your time. Perform hand hygiene.